Hey there, just wanted to share some precautions. And this is for, I'm going to list several different types of cancer that you need to make sure that you are following precautions. So, first and foremost, exercise during treatment and following treatment is not only highly recommended, but it is safe. You just have to know the precautions, follow your symptoms, listen to your body. So, breast cancer, you want to start off when you're doing strengthening with very low resistance. Monitor your symptoms and progress in small increments. Okay, don't go all out here. So, you want to watch for any type of arm or shoulder symptoms. If you have any new symptoms, you want to stop what you're doing, contact your physician. Also, where you need to contact your physician and or your lymphedema therapist to find out if you need to wear a sleeve for your strengthening program. Most of the time they will want you to, but you need to check with them on that. And then let's talk prostate and colon. So if you have had your prostate removed, then we need to make sure you're doing pelvic exercises. So when you see the program that is for prostate and or colon, make sure that you don't skip those pelvic exercises. Super important to help, especially if you've had a prostatectomy. For the colon, if you have a stoma, you want to start with extremely low resistance. Same thing as with breast cancer, low resistance. Lymphoma and leukemia, you want your focus to really be on strength training. So the studies are showing that strength training is very, very important to alleviate a lot of the symptoms and maintain as much function as possible. So also, if you're in active treatment, you may want to break up any of your exercises into small, short bouts. Each one of the exercise programs is anywhere from 15 to 20 minutes. So if you need to break that up and do 5 minutes at a time, that's perfect. Your heart rate. So if you're trying to monitor your heart rate during your cardiovascular activity, may not be super reliable when you're in active treatment. Monitor your rate of perceived exertion and remember that you're starting off with a low intensity working into a moderate intensity. So you really want that to be that you're actively able to talk and carry on a conversation, not that you are completely breathless. So that may be a better way to monitor, but ask your physician if he feels you need to be monitoring your heart rate during this time. Another two precautions for cancer and exercise are if you have had colon cancer and you have an ostomy, you need to get your doctor's permission in order to perform any type of strengthening exercises because there is a risk of hernia. So you want to make sure that you're safe to do that. Also, anyone with multiple myeloma, you want to do a program as if you have osteoporosis. So I do have specific exercise programs for osteoporosis along with tips that you need to follow because of your risk of fracture. We want to make sure that we're protecting your spine, getting everything as strong as possible while minimizing your risk of fracture.